I'm Cynthia Hammer. I'm founded the FINDtheADHDgirls.org organization, and our mission actually is to become the place for parents, teachers, and educators to learn about ADHD in young girls and how to help them. Today, we're having a panel of women. They all have been diagnosed later in life, and I think they all would agree that having ADHD is not the problem. Not knowing you have ADHD. Today, we'll be recording the panel so that if you weren't able to attend, everyone that registered will receive a copy of the recording. We'll also be making clips of parts of the panel to post on our social media. If questions come up for you that you want to have asked of the panel, just put it in the Q&A, and we'll try to get to as many of those questions as we can at the end of the panel. We plan to be here for the next hour. I'm the hostess. Diane Wingert is the moderator. And Diane is a ADHD business coach, and she also has a podcast called the ADHD-ish podcast. Good morning, Diane.
Good morning. And what a lot of people also know about me is before I became a business coach, specializing in neurodivergent entrepreneurs, I was a licensed psychotherapist for over 20 years. Let's find out a little bit more about our esteemed panelists today. Kristen, would you introduce yourself? Say what you do now and when you found out you had ADHD.
I am Kristen Stuppy. I am a pediatrician in Overland Park, Kansas. And I actually was just diagnosed within the past 6 months or so. Surprisingly, after raising a child with ADHD and being married to somebody with ADHD and always blaming her ADHD on him, I always thought I was ADHD-ish, but did get an official diagnosis relatively recently.
Amazing.
My name is Angela Greenwell. I am an ADHD coach. I found out I had ADHD about 4 years ago. I was coaching, and what I didn't realize is that people who were attracted to me had ADHD. So we had a lot in common. It took a TikTok for me to realize that I had ADHD and then start the path of getting an official diagnosis.
TikTok and Instagram and all the socials are turning out to be a place that a lot of folks are figuring this out.
Hello, I'm Narissa Bauer. I'm a behavioral pediatrician in Carmel, Indiana, and I recently was diagnosed also about 4 years ago. I see kids just with ADHD, and here I was.
Liz?
My name is Liz Lewis. I live in Central PA, close to Maryland. I'm sitting here with all of you, but I was actually diagnosed pretty young, but it wasn't exactly supportive and it wasn't like anyone explained it to me. So by the time I think I was about 33, I had to go get re-diagnosed basically because I had had a baby and I had an adult life and I hit a wall and I realized I needed help and I had to revisit all of what they called ADD when I was a kid. So I'm not that new, but I am new.
The number of people who got diagnosed early in life, forgot all about it, and then got re-diagnosed as adults, there's actually quite a few of them out there. Cynthia, can you share that with us?
I got diagnosed when I was 49 years old, and that was in 1992. So I've known about my ADHD for over 30 years, but I lived more of my life not knowing.
And my story is particularly cringe because I was in graduate school for social work in the 90s and working with children with ADHD made the observation that their parents seemed to have a lot of these traits, even though at that time, all my esteemed professors and preceptors were telling me, oh, we know that ADHD only affects a small percentage of boys and they all outgrow it by adulthood. And after meeting those dads, I thought, I don't think so. I actually did my master's thesis on whether ADHD is a lifelong condition, and I still didn't get diagnosed for many more years myself. So, one of the things we're going to be talking today about is why it's so hard to find the ADHD girls, including everyone here on this panel.
Really have to jump in here. I don't think it's hard to find us. It's that we haven't learned how to look yet. That is what Find the ADHD Girls is all about, teaching people what to look for. Because even Dr. Hallowell says it's there if we're looking the right way.
Thank you for sharing that. I would actually say two of the things that I say most often is that we were hiding in plain sight and that you can't find what you aren't looking for, and we need to do a better job of looking. So, for this first question, I'd like to open it up to the entire panel and ask each of you, and I'll call on you one at a time so that we don't interrupt each other. Looking back on your childhood, what signs do you now recognize that were missed at that time? And let's start with Narissa for this one.
Yes, I like how this question is phrased because in my childhood, I didn't even know. I just thought that's what I was and that's how I growing up. But looking back, the need to be perfect. I was the oldest, and my parents would always come to me for things, and I was the most organized, surprisingly. So I think those two things, and then just the stories that I would hear in my head. I wasn't good enough. I had a lot of that going on.
I see a lot of heads nodding.
To add to that, I actually did know I was different. I just didn't understand why. So I had internal restlessness. It wasn't external. I wasn't fidgety, but I didn't understand social niceties. I didn't feel like I belonged anywhere, not even in my own family. I had rejection sensitivity, but it was not about, oh, you did something wrong. It was more like I was so desperate to have a best friend. I wanted that best friend. I would find one and then they would have certain mannerisms, and I would take that as them rejecting me. And so I would immediately be like, oh, you just don't like me. And so I would leave friendships very early. And I think sometimes we think that people with ADHD don't do well at school. And that wasn't the case for me. I did well. But then when I decided, oh, if I could put a little more effort into this, I could actually do decent. Like I went from mid class to top 10 in a blink of an eye. So, like, it had nothing to do with intelligence.
That's such an important point, Angela. And I think this is true for so many women with ADHD, particularly those diagnosed well into adult life. Many of us did well in school, which is very different than how ADHD presents in a lot of boys, especially the more hyperactive ones. But where we struggled more was with social relationships and feeling like we were in sync with the other kids, especially other girls at that time, which is really isolating.
Interestingly, as Angela was talking, that wasn't even going to be my answer, but socially, I struggled having friends a lot, and I always blamed it on being an army brat. Every time I tried to make a friend, either they would move or we would move. So there was that, but I always felt like I struggled having friends growing up. So many with ADHD do. I just didn't place that in my bucket of, oh, that's an ADHD symptom. I, like Narissa, super organized. And my kids used to laugh at me because I would always say, if it's not on the calendar, it's not going to get done. So you have to put all your stuff on the calendar. Help me out here. From the time I was very young, always had to have lists and check it off and do things. I wanted to be good. I knew I was smart and I could do it. It might take me longer to do some of the assignments because half the time I was probably daydreaming, but my mother would yell at me, why is this taking you so long for everything? Cleaning my room, doing whatever. And it's so obvious now in hindsight, these were all very classic things. Emotional dysregulation, just losing it more often than I probably should have without anybody really noticing that is a problem. I just sucked it up and dealt with it because I wanted to be good. I just buried it in and kept going. So there were a lot of things that now are easily check, 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 meeting all those criteria.
What's most fascinating to me about what you just shared was that you're still learning. You're still learning from talking to other adult women with ADHD. So I think so many of us fault ourselves for not figuring things out sooner. But there's so much diversity within this diagnosis and so much variation with how it presents from one person to the next that I think we're going to continue realizing things for the rest of our lives, even though each of us is a legitimate expert in this field. Liz, please share with us your experience.
I think I knew, and I've asked women this question on Zoom meetings, and I've also asked it in person at conference. Who knew you were different? Years when you were a child, years before ADHD was even something you knew. But everyone inevitably raises their hand. For me, because I was diagnosed around like middle school age, it wasn't that there weren't any signs. It's not even that they were necessarily missed, but because of the chaotic nature of my family and home life, and then some stuff that happened in middle school, which is how I ended up getting diagnosed, I think the signs and the symptoms, as you would say, they were just misattributed to other things. It was always like, oh, her parents are in the middle of a divorce. Oh, her mother just had a baby. Oh, her stepfather just died. And so I think it was really easy to make it a me problem. And it was, even after I was diagnosed, it was a me problem. This is your personal problem that you need to deal with. And please do not like inconvenience anyone else with this. So it wasn't so much it was missed, it was just totally misunderstood and unsupported.
I see everybody nodding. In my experience, first as a therapist, working with folks with ADHD, and then later as a business coach, I agree with Liz 100%. We all knew we were different. We all knew there was something different about us. And long before we got to an official diagnosis, we went down a list of what I call attributional theories. It's because you were adopted. Oh, it's because there was abuse in your home. Oh, it was because you were not the favorite child. Oh, it's because whatever it is. And we believed those stories until they didn't do a good enough job of explaining. And then we moved on to the next one. And when you finally found out it's ADHD, you're like, oh, that connects a lot of dots, doesn't it? Why are girls typically overlooked when it comes to ADHD? What are the generalities?
Yes, this is such an important question. Events like this are important because we're pointing these things out, and there's a lot of people that still need to catch on to everything that we're saying. But the typical look of ADHD, or when people think of ADHD, traditionally it's been boys who are hyperactive, impulsive, dart across the street, can become aggressive, emotionally volatile. And they come to our offices pretty early for a diagnosis because in some cases it's a safety concern for the child as well as for others in the classroom. And then girls are not typically that way. And I say typically because obviously there is a spectrum, and I've certainly had girl clients and patients who do have hyperactivity, but it presents differently. Especially in girls, they're more likely to have other things showing up with ADHD that can affect how ADHD presents itself. And probably the biggest one that I see is anxiety. And so it can change the flavor, the outwardness of how ADHD presents, especially through the lifespan. And I think as girls, society wise, we are trained to do as we're told, we want to please. And so this shows up in everyday kind of society's way of looking at girls. And I think this is why so many of us have gone through our lives ascribing it to something else.
And Kristen, isn't it also true that even the girls that are more hyperactive and impulsive or are combined types, so they have the inattentive and distractible traits as well as the hyperactive and impulsive traits, isn't it true that they may still behave differently than the boys? What more can you share on that?
I think actually the chatty Cathy was an example I was going to give because so often that's just seen as a trait that girls talk too much. And so that's normalized. And yet it's an impulsive behavior. They know they shouldn't be saying what they're saying, and yet they're still doing it. They tend to daydream or distract easily. If it's all up here, the teacher's not recognizing it, the parents aren't recognizing it, as opposed to the boy who's running around the room or the typical hyperactive ADHD that you envision, touching others, out of their seat, all of those things. Teachers are bothered by that. It bothers the classroom. So teachers will talk to the parents more quickly to try to get things under control in the classroom. Whereas if the teacher is saying, hey, Diane, did you get that question? I just asked you a question. Diane, do you know what the answer is? You might have been daydreaming and not realize that the teacher's asking you a question. And you're a smart kid, so you can make it up. You can figure out the answer really quickly. So teachers don't think to talk to the parents about that because you're masking it without really even trying, right?
And it's easy to see how some of these traits can actually develop a sort of resilience because even when you're making a mistake and getting called out, if with your quick brain you're able to turn it into something that works, you may not get that referral. It sounds like more of the referrals to pediatricians and child psychiatrists for the younger kids tend to be initiated by the school in boys because there's a disruption to the classroom problem.
I have recently had some girls come to see me and they would say, I was the one who asked my parents about it,
Are they
which
like
is
taught?
huge. Which is huge. And having parents who are responsive and say, okay, let's look into this.
Wow.
Yeah.
Yeah.
Doesn't.
Yeah.
Yeah.
But even so, you just said that the child is asking. It wasn't the
Yes.
teacher who warned the parents that there were things going on in the classroom that were clue. I do feel like teachers, at least in my community, are getting more education and they are making some of these comments, but they're also making accommodations within the classroom to support these students. So then the parents like, we don't need to do anything about it because the school's already dealing with it. So it's a more balanced view with a whole team of medical professionals in addition to the home and the school, I think could be more helpful.
Absolutely. How do you see some ways that masking shows up in undiagnosed girls that affect them in the long term?
I'm going to use my niece as an example. I have a niece who started kindergarten, and my sister in law, I think she texted me about 2 weeks after school started. And she said, the teacher emailed me and said that she is talking a lot and is disruptive, and that and she's only 5. She was a 5-year-old kindergartner, and that she's having trouble transitioning between the stations in the rooms. And I don't think she's particularly oppositional. She's just got a lot of sparkle to her and she's very social and yeah. So when my sister-in-law was telling me about this and about the conversation, or I guess the email back and forth with the teacher, I just kept thinking to myself, so from now until probably first grade, we're just going to be training her to mask all of this stuff. And I said, the force is strong in this one because she's a little bit more overtly hyperactive, my niece. But my point here in telling this story is that little girls know when being different is not acceptable to the adults around them. And they're very good at adapting to what the adults want them to do. The problem I see with that is that it's a behavior that sort of starts very young and it goes through adolescence and middle school and high school. And sometimes by the time we're, I don't know, 18, 20, college age or whatever, we no longer know how to be our full selves in any situation. And that is the problem that I have with masking. It's not that they don't need support. It's not that my niece doesn't need some support. It's that we are, instead of trying to figure out how to support her, make her a better version or a more confident version of herself, she's only 5, we're going to blunt the edges on her. I don't know what the solution is, but I see this a lot. And I see women who are 35 started doing this in kindergarten and started being or chatty, and they just shut off that part of themselves.
This sounds very relatable. Kristen, in your practice, you must be seeing little girls who are also coming in to see you with a mother who has ADHD. And maybe they're finding out about both at the same time. In fact, it's my understanding that women over 40 are the fastest growing group of people being diagnosed, oftentimes because they're bringing a child in, having no idea that the apple didn't fall far from the tree. How do you see the masking that starts young affecting a woman over her lifetime?
I feel like even in the adolescents who have been masking all along, hadn't gotten identified when they were younger, all these walls they've built up, a lot of anxiety because they want to do well. A lot of these people have that perfectionistic, which actually is, parents love it. They're like, yes, my daughter's so perfect. She does all these things. I don't have to remind her because she's so organized. But because they're putting all that mental energy into it, it is emotionally just draining. And so anxiety shows up that way as kids and their parents are more responsible for showing up to appointments and doing things. These are the families who are chronically late or miss appointments because when motherhood takes a hold and all these additional things, you're not just responsible for yourself. Maybe all your life you could do it, but now you also have to juggle your kids, the household stuff. It just becomes overwhelming. So it can show up in many ways, but anxiety, I know Narissa already brought that up. That's the number one thing that travels along with ADHD, especially untreated or unrecognized ADHD.
Yes, and as a former therapist, I will tell you the vast majority of women that I ended up uncovering their ADHD and diagnosing them came in with a diagnosis of anxiety. The vast majority, many of them also depression and some other things. Let's take this masking topic a little bit more personal with the next question. Angela, how did masking show up in your own life? And even though you're still unpacking it and dealing it, what do you think it has cost you in the long run?
For me, my masking was unconscious. I was not like aware that I was doing it, but I was still doing it. So there was, again, this need to fit in. And there was this feeling of wrong, like tension in my body that I was trying to get rid of. So the cost I mentioned before with authenticity is extremely exhausting to run around all day long trying to act like everybody else. And so with that loss of energy, it's hard to make progress on things that are authentically you. So you don't really understand yourself all that well. You don't know what you like. You don't know what your gifts are. I remember my mother once said, "You just need to be yourself." And I'm like, "What is that? I don't know what you mean when you say that." But I did have this feeling that I had so much to contribute. I felt like I was incredibly bright, creative. I had a lot of gifts, even though I couldn't put my fingers on them, but I couldn't figure out how to bring them into the world and sustain them. And so as a result, like I didn't like me. There was a lot of self-loathing of you suck. What's wrong with you? And you talked about attributing things to maybe it's the way I grew up. I attributed it to me and a moral failing because of trying to figure this out. My path was very erratic. Maybe the answer is here, or no, that doesn't feel right. Maybe if I do this, that'll fix it. So rather than having this consistent life that you're building upon and you're seeing progress over time, to me, it felt like I was planting trees all over the earth and leaving them and never letting them grow or nurturing them. That's just a very unfulfilling, deflating reality.
That is potent.
Mm.
I want to ask this same question of Narissa in particular because most people would hear you, you're a physician, and most people, that's not an easy thing for a woman in particular. And you have a history of being organized and being a perfectionist and having everyone in the family look to you, even as a child, like she knows what to do. And yet, I think we can all say we all masked. And even though you've been successful, it still cost you. What is that cost for you?
Yeah, Angela, when you were just talking, I was resonating with a lot of what you said. And I think for me, I got burnt out in my career in academia. I was always the one who had to smile and put on a brave face, but at the cost of my own physical health, my mental health. I remember the last year in burnout, looking back now, that it was a very rough year. And I didn't know what I didn't know until on the other side. But I just remember people saying, "You're the one that always is smiling. What's going on?" I felt like all of a sudden this mask that I didn't even know I had was falling. And I didn't know what to do.
Mm.
I just knew I had to have a change. And that started the journey towards this whole path of trying to find myself. And maybe now my career path allows me to be authentic with who I am. And I just feel so much better. Finding my passion and being able to express it, I am so glad and so grateful for that opportunity.
I think it's one of the reasons why so many women who realize they have ADHD end up joining the ADHD professional community in some way. We have several coaches and physicians here who largely specialize or exclusively specialize in working with folks with ADHD because you're bringing your professional experience combined with your personal experience. And it is so very gratifying to finally be able to share all of who you are, even the parts you didn't know were there because you were even masked to yourself. Let's hear from the coaches now on the emotional and mental health challenges that you see most often in the women that you work with who are diagnosed late. We've talked a little bit about anxiety and touched on depression, but what else do you see? And I'd like to first hear from Liz.
Aside from the coexisting anxiety and depression, which I feel like those go together like peanut butter and jelly, I don't think I've ever met anybody who has pure ADHD, like at all. But there's just the overworking, the people pleasing, the really external, being very externally validated. Like it really matters how other people perceive you, how other people read you. There's a lot of mind reading going on of other people. We're always obviously the rejection sensitivity, although I don't bring that up. I don't have to because people see it on the internet and they bring it up. There is this perfectionism thing. This I almost have to go above and beyond and be better and bigger and more successful because of this thing. And that's the kind of stuff they bring into coaching late in life. And that's also the reason why I'm pretty firm, especially when someone is, to me, I can tell they need more assistance and support. I'm very prone to talking to them about counseling and therapy because I feel like coaching works better as a team effort. And I do think it's very confusing online for people when they're late diagnosed and they jump right into coaching. It's easier to find a coach than it is sometimes to find a well-informed therapist. So they jump in. And then someone sits in front of you and they want you to give them some kind of secret sauce to make it feel less hard.
You can't blame us, especially after spending so many years struggling. Once we find out what it is, we want the solution and the healing,
Yes.
the recovery
Solution focus.
fast. We want it fast because most of us
Yeah.
feel like, oh, I've spent so many years stumbling around in the dark. Now that I know, can we make this? Like, that's not how it works.
Yeah.
Angela.
I would agree with the perfectionism, the people pleasing. I talked about self-rejection, which kind of goes into perfectionism. And I love the phrase of shoulding all over ourselves, like using should to police ourselves. I want to dig in a little bit more to the perfectionist side of things because I think people don't quite understand it. Like this idea of it's not even the idea of being perfect, it's the idea of earning our own self worth, earning our self esteem, proving that we are enough to ourselves. And it's like we're trying to get to a state of homeostasis. We want to rest because there's this internal tension in us constantly, and we're trying to resolve it. So perfectionism seems like a path that's viable, right? And the path of perfectionism is like absurd. For me, it was invent a goal that was so impossible and then put all your heart and effort into trying to achieve it. And then if you happen to make that bullseye, like I might consider liking you. Before I knew I had ADHD, was I had my second son and I decided I didn't want to just be a mother, right? Like very poo-pooing on motherhood, which is like awful. So I decided I was going to be a marathon runner, having never run ever in my life. And I started this journey of getting the training plan. And it wasn't enough to run a marathon, not being a runner and having just had a child. I wanted to qualify for Boston, which the tiniest amount of people qualify. And so I got my own coach and I did all the things and I was obsessive, getting up at 4 a.m. and running 17 miles before work started. And so the day came of, does Angela accept herself? And I had a fabulous race until about mile 22 when my legs literally fell out from underneath me. And I somehow stumbled to the finish line and missed my goal by 7 minutes. I was livid. I was so livid. I was like, you suck. You can't do anything. Like I was angry and I had to stop running for years because I put so much weight of myself in achieving that goal rather than just allowing progress and like the fact that I showed up to be enough.
This is a powerful story, and I think it really amplifies just how potent and insidious our perfectionism is, because I refer to this as too much is never enough, because we literally don't know what enoughness is in anything. You ever feel like, okay, that's it. Now I'm good. Now I can feel good about myself from now on. Nope. We've been talking about how undiagnosed ADHD being missed in childhood.
I just want to say that to feel that you're never enough, that's part of the healing journey. It could take 3 to 5 years People are surprised to hear that, but that's what Siri Solden says. Even after a diagnosis, it can take that long to heal the damage that you've done to your self esteem. Learning that you are enough and accepting that you are enough, it takes a while.
I appreciate you stating that. What all of us know, but none of us have mentioned yet, is that when we do find out, most of us go through something like the 5 stages of grief and loss. Most of us think, if I had only known sooner, I would have had a totally different life. We can't know that for a fact, but it's very painful at 30, 40, 50, 60 to have that thought, and absolutely need for healing. Most of us would benefit from working with a therapist, either in addition to or prior to working with a coach. Most people are going to have some feels that they need to work through one way or another, whether that's with a professional or not. Let's talk now about, and two, parents and the professionals specifically, because we've been talking for a few minutes now about how each of us has come to terms with it, how the signs were there, but no one was looking, how it has affected each of us to be identified late, and the changes it's made and the things that we have needed to adapt to and release and heal from. For the pediatricians, Kristen first, what are the signs that you wish parents, teachers, and others involved with young girls took more seriously?
There's so many because every child presents differently. So taking a look at everything from, do they seem distracted? Do they have a hard time transitioning from one activity to the other? Are they like the perfect child in public and then lose it at home because they've been trying so hard to maintain that perfectionist outlook to others? Are they disorganized? Do they do the work but then lose it or forget to turn it in? There's a list on the Find the ADHD Girls website, a list of questions to think about. I wrote a whole blog on that too because there are so many things. It's just like with the hyperactive kids that we tend to picture, they all look different too. They tend to have more things that are easily recognized, whereas these girls who are internalizing their things and masking, it's harder to pick those out. So having to know a longer list to look for the one or two things they might be showing is harder, but it can be done.
Yeah. So, in addition to what Kristen said, the girls who tend to be lumped in as being overly dramatic, I see that a lot as well. Then the classic signs of perfectionism, the anxiety, the stomach aches. Many times parents will come to see me knowing that I specialize in ADHD and anxiety and say, no, I think it's just anxiety. I think it's only anxiety. That's why part of what we do in the workup is to do a very thorough history observation, collect subjective data as well as objective data that I do at my clinic to really suss out what's happening so we know what we're treating, but just being open to the possibility because, again, it's symptoms that we're reporting. It's not necessarily indicative of one thing, but things tend to hang together. And I think it can be overwhelming to parents, but if you have a suspicion, trust your gut. If your child or teen brings it up, talk to your pediatrician, and together, we can talk through it. Just bring it to someone who can be knowledgeable and understand and look for the patterns.
And Kristen, beyond medication, what are other forms of support that we can be thinking about and suggesting and supporting young girls with?
I always tell families that medication is fantastic and it is well used, it is well studied. It does have side effects, but far and away, it is one of the best things that can help most people with ADHD. That said, you cannot ever forget the basics. We have to eat, we have to sleep, we have to exercise. Those things help the ADHD mind as much as they help our health. And then school accommodations. So many parents are afraid to talk to the schools because they don't want their children labeled. But the labels happen because of behaviors that are unexpected or undesired. When we have those proper supports, the behaviors become, and so getting those accommodations at the school level can help. Coaching, we have a couple coaches here, I think can teach some executive functioning skills. Those can be very helpful. There are so many things. So for the parents out there who might be afraid to get a diagnosis, because they don't feel like they need the medications, the diagnosis could still help with some of those other things.
Marissa, is there any other form of support that comes to mind that hasn't been mentioned?
Yeah, I think Kristen mentioned all the big ones. Part of this is beyond the diagnosis. It unlocks the feeling of, okay, let's roll up our sleeves and find out and understand what ADHD is. Knowing that ADHD is a spectrum, it's really important to allow kids and parents to explore in safe spaces what that looks like for them and to empower them. It can be really easy for us to just say, okay, we're going to do this and this, but really trying to bring that together so that we can educate our kids and our teens and us. Both just hearing this conversation, I'm like, that's definitely something that I've struggled with and I never put that together. Just being open to learning and receiving this information and then reflecting on that together with your child makes a huge difference to rebuild and reshape that narrative in their minds about who they are.
Some of the more painful conversations, but wonderful conversations I've had with my adult children, all three of whom I passed on my ADHD genes long before I knew I had it. If I could do something over, and I try not to indulge regret because it just feels awful, but I think if I could reparent them, knowing what I know now, I would have made a much greater emphasis on helping each of them figure out what they are really fascinated with and what they really love to do early on so that they would have ways to feel good about themselves, even alongside the challenges. I did not make enough of effort to do that. I consider that part of treatment too, helping your kiddo at whatever age they are, even adult, figure out what they really like and what they're really good at so that they can do as much of that as they possibly can. As we're reaching the end, I want you to just name one thing because so many really helpful and amazing things have been shared. But if you could change one thing about how girls with ADHD are supported early on, what would it be?
I hate limits of one thing. I know. I'm going to try to weave these two together. One of the things that I see is we are overly attached to our thoughts and feelings. And our brains are not reliable narrators on what is happening in the real world. We have these stories and we have these feelings that we think we should act on, but they are not very reliable. One of the analogies I like to use with my clients to help break this concept up a bit is that you're a sailboat. You are not a motorboat. Like, we need to look at ourselves differently. The neurotypicals have a throttle. They have more reliable motivation. Yay for them. You're more externally sensitive. So, like, you have sails. When the wind blows, you move in a direction rather than to listen to these thoughts and feelings that are that neurotypical language is to realize that you have a different vessel and to learn how to navigate it. What does it mean to be a sailboat in this world? How can you move your sails and get to the same places that you want to get to? And it's a different methodology. You don't always have wind every day. Sometimes there's a lot of big storms, and that's when we get those great hyper-focus moments. Some days it's just a mess and there is no sailing for anybody. And that's when we need to have a lot of grace and self-acceptance in those moments. So just changing the way that we view our life and how we live our lives into a model that's way more about self-awareness, adaptability, reactivity, so that we become more of a master of our vessel rather than trying to make it into something.
I love me some analogies and metaphors.
I have been tossing back and forth this question. This is a difficult one to answer because, again, every person is unique and different. But I am going to put my doctor's hat on. Medication is so very helpful. I wish we could change the feeling on that because so often people are afraid of medication and it changing the brain in a negative way, whereas we have studies that show that it actually helps brains grow in a more typical fashion. I really do feel like for most people, they would benefit from medication in a way they could tolerate it and not change their personality. It just needs to be a close partnership with your prescriber to get the best medication at the best dose for the individual.
I love that.
Thank you, Kristen, for saying that. I would say to parents, connection before compliance, because that probably is the one most important thing as we're trying to navigate these rough waters and trying to figure out why is she doing this at the end of the day, just trying to keep yourself in check, but also connect with that child who is struggling or has lagging skills and doesn't know it yet, but connection is so important.
Liz, how about you?
Along the lines of what Narissa was saying, if your daughter has just been diagnosed, or if you made it this far and got yourself diagnosed later in life, take your time. Take a moment, sit in the discomfort of it as a family, but look at it as a family thing. It's not a you thing. You don't have to fix your daughter or overly manage her. Get curious about her, try to get to know her, see if you can get her to talk to you about how she's feeling and thinking how she feels about the diagnosis. Don't frame it as like an individual issue that you have to jump on immediately. You do not have to take immediate action. Talk to the person who you worked with, whoever diagnosed you or diagnosed your child. Ask them what they think the next step should be, or for referral to a family therapist or whatever. My point is, take your time, be thoughtful about it and curious about it and open minded. That's it.
We are not a problem to be fixed.
No.
Do we have questions?
There was one question I marked as resolved because we were going to get to it, which was how does getting an official diagnosis change things for you?
Someone was saying, how can I best support my daughter who has ADHD? What about resources to help her understand her ADHD and how it impacts them? It depends on the age of your daughter, but on our website at the repository, we've created 27 short cartoon interviews that describe ADHD. That's something maybe between a 7 to 10-year-old might enjoy watching with the parent. I know Narissa and Kristen have a program where parents come to learn about ADHD along with their child attending the class. And something like that would be very appropriate. Then on our website, FINDtheADHDgirls.org, we have a resources list. It's not things that our organization made, but it's a vetted list of resources. There are some books we list that were written specifically for children to help them understand and accept their ADHD. There's another book that's written for teenage girls. It's like a workbook to help them go through their experiences with their ADHD and to understand them. Beyond that, a lot of it is how the family talks about ADHD. Next month, we have an interview with a mother and her 12-year-old daughter who got diagnosed early. The mother knew about ADHD, and her daughter grew up knowing. Now that she's 12 years old, she is a great self advocate. She knows what she needs, and she's willing to speak up for it. That's the thing, to empower these girls that how you are is perfectly fine. You just need to know what it is that helps you to function at your best and to be willing to ask for that.
As we only have a couple minutes and we want to be able to have Cynthia wrap up and say thank you
Well,
to everyone.
about diagnosis, wasn't it?
How does getting an official diagnosis change things for you?
As an adult?
They didn't.
Well,
Do you want to answer that?
there's a lot of disagreement in the ADHD world whether people are allowed to identify themselves as ADHD or whether you only can say you have ADHD if you have been diagnosed. If it describes you and it fits you, fine. Just start learning about ADHD and apply the strategies and tactics that help you to live a more fulfilling life. I tell people my age that you might only want to seek a diagnosis if you wanted to take medication, because that's the gateway for getting medication. But even as a child, getting identified, it's so helpful to understand that you are ADD like and that doing these things a certain way is going to make you function better. I don't feel like everyone needs to get a diagnosis. Maybe you have 3 symptoms of ADHD. You don't qualify for a diagnosis, but still understanding that this is how you work in the world be easier for you to manage if you understand these things. I'm open to that. But for a parent trying to get a diagnosis, you can even access psychologists who will diagnose remotely and then work with a local pediatrician who accepts that diagnosis to work on your medications. We have an article at our website on how to proceed, how to get a diagnosis, and what to do once you have that diagnosis.
Cynthia, I would also say, because I often get asked this question, it's one of the main reasons why I changed the name of my podcast to ADHD-ish, to be more inclusive of people who identify but choose not to be diagnosed. There are many legitimate reasons people choose not to be, but especially for adults, the 3 reasons that you might choose to be diagnosed: medication, validation, accommodation. If you need accommodations at work that you're not going to get without an official diagnosis, if you want to try medication, you cannot get access to that without an official diagnosis. Or if you need it to feel validated so that you can begin to live with that truth, that's totally legitimate as well.
Sometimes you need it because your family doubts you. It's not just me, it's this outside expert who's saying I have this.
That's validation at its finest.
I don't know what more I could say because we've had a wonderful panel. I'm glad that these women are comfortable sharing their heartache and their hard feelings. I hope you go check out our website, Find the ADHD Girls. We make all our materials available to you for free. We want them to be shared as widely as possible because we see that educating people how to recognize ADHD in girls, that's how we're going to move the needle so that girls get diagnosed as soon as boys. It's like detective work. You can't say it's 1 or 2 things. With a girl, you're usually putting together 3 or 4 things, saying, aha, oh, this is making me think about ADHD. And just realizing that early diagnosis is how you're going to help these girls the most in their lives.
Absolutely. So thank you to not only all the panelists, but all those who watch this on the replay.
Goodbye.
We believe all girls with ADHD should get a fair start in life by getting diagnosed by age 8. Visit us at www.findtheadhdgirls.org. Thank you.